Hi, good evening. Austin Mayor Steve Adler. Got a minute? We're going to go over the data. This is Tuesday, which is data dump day, which means we have Dr. Escott's and Director Hayden Howard's slides, and we'll go over those just as soon as we go through the numbers in the dashboards. But before we get to the numbers in the dashboard, I want to introduce you to my new layout here. Diane has kicked me out of the bedroom, which is where I had my little station set up before. Now moved me to another spot. She's reclaimed the bedroom, but I'm still broadcasting and good and appreciative that you're here to see the numbers. Let's begin by taking a look at the dashboard, and in that regard, we will begin with the key indicators, which is the first dashboard we always take a look at. Here it is. The first number we take a look at is 66 new admissions. We look mostly at the 7-day moving average. It's at 66. This is the number, the 66, that is graphed on the color graph in the middle. Today, our 7-day moving average is the same as the number of new cases we see. We can see we went up and then have come back down. That's the trend that we're seeing at this point. Still concerned though, because we have 681 new cases. Those 681 new cases significantly above the 7-day moving average of 554. The percentage of positivity shown here at 12.4. We'll give you the more exacting numbers from Dr. Escott's presentation in a second. The number is continuing to go down, not anywhere near enough. We have to get it below 5%. We got to get it below 3%. We're still in a red zone. I mean, it feels a little better at this point because it's going down and we're not scared of filling our ICUs. It feels a little better because there's a vaccine that some people are beginning to get. But we are still in a red danger zone, trying to get it below the 50 or 60 that Dr. Escott will be looking at. It'd be great to be able to move to the orange area. The green numbers on the bottom tell you the 7-day moving averages for hospitalizations and for ICUs and for ventilators. But we'll take a look and see how those 7-day moving averages are doing with the as compared to what the numbers are today. And we'll do that by pulling up the Travis County numbers. And here they are. This is, you can see we've crossed 70,000 cases. That's with the 681 cases that we have today. 70,000 cases. People in Austin have gotten this virus. When people compare this to the flu, you don't have to look much past this number to see that's not the case, much less looking at mortality and the like. In fact, speaking of mortality, 672 people have passed away. Yesterday's number was 660, which means there are 12 people who passed away in the last 24 hours. I mean, this is real. There are 12 families that are mourning someone who passed away, not having the ability to have people all around them, their family all around them. This is still real. It is still deadly. People are still dying. Number of people hospitalized, 504. The 7-day moving average is 531. So that's moving in the right direction. Number of people in the ICUs, 147. That's down from the 7-day moving average of 155. People on ventilators, 102. The 7-day moving average is 98. So it's above that number. I am concerned about the number of cases. Those number of cases translate into hospitalizations, ICUs, and mortality. Unless what we're seeing is younger and younger people represented in the number of new cases. So we want to see what the demographics are showing us as we continue to move forward. But generally speaking, still a downward trend on hospital admissions, on ICUs. Remember, ICUs, we were concerned and we came really close to going above 200. We're now down to the 147, the 7-day moving average at 155. That's a pretty considerable move for us and in the right direction. All right, so you ready for some data dump? Let's go through some slides that were presented. I'm going to begin with some slides with some information that actually KVU did, an article on the impacts of COVID-19. It was reported by Don Kettle. We took some of that information. We want to present it to you here in graphic form. So let's see if we can share that slide, see how that looks to you. Number here, one person has, in the last 30 days, just in the last 30 days, one person has died from COVID every 5.25 minutes, just in Texas, in the last 30 days. It's only been a month or two that we've gone from 1 million cases to 2 million cases. In the past 30 days, a person has died in Texas from COVID every 5.25 minutes. People diagnosed with COVID-19, the number of people that have been diagnosed, number of people, 2.3 million people. That is equal to the population of Houston, the number of people in Texas that have been diagnosed. COVID-19 cases are diagnosed, 14 of them are diagnosed every minute in Texas right now. And there are likely 14,000 more Texans that will die of COVID-19 before May 1st. I say all that to emphasize that we can't let up our guard. This is still real. We're still in a red zone. Please keep wearing your mask and social distance. Wash your hands. Avoid large groups until we can get into orange, and then limit those large groups to 10 people. But anyhow, we're not there yet, so we're in red zone. This is the slides. You can see the information that came from Dr. Escott today. The yellow line is the 7-day moving average. The blue line is the actual number. These are confirmed cases. Numbers starting to go down. We have a little bit of a peak here, continuing with the 681 that we had today. So that's a little bit of a concern, but you can see the overall movement. Number of new admissions to our hospitals going down. That's the number we saw. We got to 66. We were up to 90 before. This chart that's hard to see, blue lines, admissions, you can see going up, coming back down. This is ICUs, went up, come back down. This is ventilators, pretty much flat. These are all lagging indicators. If we continue to go down, soon this line will mirror that line, soon this line will mirror this line, and then we'll mirror this line if we're able to keep it going in the same way. Just a way of comparison, this is the surge number. TSA O is the one of 24 regions that Austin, Travis County are in. Right now, the hospitalization percentage for COVID is 14.59%. That's below 15%. We've been below 15% here now for a 7-day period of time, which means that the governor's order takes occupancy in restaurants and retail up to 75%. The other regions, main regions have not gotten below 15%. You can see what the number is in Houston, El Paso, Dallas, and San Antonio. I think that's probably the range last week, 14.59 to 12.19. This is another way to look at how we're doing comparatively to other people. These are cases per 100,000. Again, the top line is El Paso. This down here at the bottom is Travis. The other counties in here, Harris, Lubbock, Tarrant rather. Dallas and Bexar County are in this area here. And you can see how we're doing. You should be proud of that. That means we're saving lives. This is the number of deaths in Austin, Travis County per 100,000 people. We're just above 50. Our trend line is flatter, but not too dissimilar to the other big city counties we've seen. And where this is most significant, even if we're following a similar pattern, is that it's the area underneath the curve that, if you were to measure this area, represents the number of people that have died. This represents the number of people that have died here in Lubbock County, El Paso. And you can see per 100 that this area under our line is a lot smaller, which means we've saved a lot of lives here in Travis County. This is the modeler right now at the University of Texas. Line is kind of flat, but headed down, which is good to see. That's admissions, that's hospitalization, same pattern. That's ICUs, same pattern. Remember, we were trying to avoid going above 200. It looks like if we keep up what we're doing now, we'll be able to make that. Here is hospitalizations by age group at the top. You can see the lines for folks over 80, 70 to 79, and 60 to 79. The number that's dropping is 50 to 59. In the middle, you have the three age groups that are kind of the younger middle ages. Those are people between 30 between 20 and 50. Remaining relatively constant during this period of time. If anything, the 20 to 29, the yellow line seems to be going up. This is a restatement of the same thing. You can see the total number of cases in our city in the last week. Hospitalizations has gone down from 504 hospitalizations to 400. That's good. That's the total number. And the numbers in each group going from 107 above 80 to 73. In the age group of 70 to 79 going from 108 to 83. In the 60 to 69 group going from 86 to 87, remaining basically flat. But you can see why it is that we're trying to get the vaccination as we get them out to folks over 80 and certainly over 65. Numbers going from 76 to 53 going down. So those are all good indications that we're seeing. We need to keep that up. Here is demographics by race and ethnicity. You can see the blue line is the white population, white non-Hispanic. Hispanic numbers maintaining below 40%. This is, I think, here at 38.1%, a slight decrease in the Hispanic Latino community. Here's African American. It's at 10.7. It's gone down, still higher than its percentages in the community. This is that same kind of information, looking at hospitalizations by race and ethnicity. Sometimes the numbers differ in total because we have some race, ethnicity that we're not sure of, so we don't have full data on all people. But you can see here again, this is Hispanic going from 177 down to 142. Anglo or white population going from 200 to 175. African American going from 60 down to 40. You can see how those numbers are trending. This is positivity, an important number in our community. We were down at 5.3, fighting to get to below 3%. We didn't do it. Instead, we ran into a bump after Thanksgiving, ran into a bump after Christmas. No bump after New Year's Eve. Numbers started coming down. And in the last week, the best numbers we have are at 11.7, down from 13.3. This is the trend we need to continue. We need to just get it down all the way to below 5%. Each one of these color blocks represents a different week. And then this is race and ethnicity within that week. The gray line that's coming down but still high is Hispanic or Latino. The green line that's going up is American Indian, Native American, or Alaskan Native. And not very many people, but the number going up. Otherwise, generally speaking, the numbers are coming down on positivity. This is another way of looking at it, but based on age. Each one of these is a different week. And you can see the numbers coming down here, especially in terms of positivity. The folks that are 70 to 79, that wasn't an outlier before. And the 20 to 29 seems to be going down as well in terms of positivity. This is positivity of school-age children in high school, middle school, elementary school, and preschool. Generally speaking, the younger you are, the lower the positivity number. This is the chart that shows us flu. Remember, we wanted to keep this number this year below what it had been in past years. We wanted to keep it under 2%. And thus far, we're demonstrating we can do that. That keeps people out of the hospitals. In past years, our ICUs filled up with flu patients. Again, we're still in the red zone. We're trying to get to below 60 so that Dr. Escott will consider taking us down to the orange zone, which when we get down to the orange zone, then we'll be able to gather in groups up to 10. Still keep the recommendations, keep the masking, keep the social distancing. Still during this period of time, we're in the red zone. Keep dining and shopping to limit it to essential trips. Try not to gather with people outside your household. Avoid non-essential travel. Make sure that you support the businesses that are really taking it on the chin right now. Here's an interesting chart that I think comes from Director Hayden Howard, but this is the vaccine eligibility flow chart. Tells you how we're treating vaccines in the city. I'm afraid this might be too small for lots of folks to read, but let me walk you through this so that you can see the flow chart. Over 65, that means that you are eligible to get a vaccine. It doesn't mean you necessarily get scheduled for one, because we have 10 times as many people that are eligible as actually getting the vaccine at this point. But if you go into the City of Austin Public Health, and register right now, and know that if you register and you're below 65, you're not going to get any kind of confirmation, but you're in the system. If you're over 65, you should get an email recognizing that you registered, but it won't tell you to set an appointment yet, again, because there are 10 times as many people eligible as we have appointments. But if you're over 65, you're going to be eligible for appointments, and I'll talk about how you get noticed in just a second. Over 65, you're eligible. What if you're not over 65? Well, if you're over 50 and have a medical condition, and or you're in a community that is disproportionately impacted by COVID, if any of those things are true, then yes, you are also eligible to get a vaccine. Doesn't mean you can get one yet, because we don't have enough supply to go around. But if you're over 50 with a medical condition, or come from a community disproportionately impacted by COVID, you can get there. What if you're over 50, vaccine is limited, and you get added to the wait list when availability happens? What about if you're under 50? Well, if you are 18 to 49 without insurance or underinsured, and in a community that is disproportionately impacted with COVID, then you also are eligible to get a vaccine in the city. And if not, vaccines scarce at this point, then you'll get added to the wait list. So you go to Austin Public Health, sign in. If you're having trouble, you don't have a computer, it doesn't work for you, call 311 or call the nurse's line in order to be able to get in. That's a posted number. I don't seem to have it right now in my notes, Reach out to my office if you need to get it. Reach out to Austin Public Health, but there's a phone number to call to actually speak with someone live who will help you get registered over the phone. Also help you get an appointment if there are appointments available and if you are eligible and are able to do that. Otherwise, you go on the website, sign up, get registered, and at the point where there are open spots, you can go online and register for an appointment to get a vaccine. Now, what we're trying to do is to get the vaccine to the people that need it the most, the people that are most in danger of dying if they get the virus. When you go on to the Austin Public Health System and register, you get scored. You get a particular score. The older you are, the higher your score. The more comorbidities you have, the higher the score. If you're in a population which is particularly vulnerable, the higher the score. So when the Austin Public Health is announcing that they have spaces available for people to sign up, and that's going to happen on Tuesdays and Thursdays, when that happens, Austin Public Health is reaching out and sending emails or calling people that are the highest score people to give them notice that in 2 hours they can go online. They can call to get someone to help them get a time, or they can go on themselves. And we'll be calling the people over 80, the people with the highest scores. We're also setting up a call center with Travis County that's going to be reaching out to people that are most vulnerable to again, let them know. We can't reserve the spot for the people that are most vulnerable because the state rules don't let us do that. But what we can do is give advance notice a little bit to some of the people that are most at risk in hopes that the numbers that we see will demonstrate that we're getting the vaccine to the people that need it the most. We got some partial demographic information on how we did that first week. Director Hayden Howard says that we should get some more demographics this Saturday to tell us how we did with complete numbers in that first week, plus numbers on the second and third week. Know that we are getting out all of the vaccines we've gotten, 36,000. We're getting another 12,000. That'll get us up to 48,000. We're getting them out just as soon as we get them in. But know we have hundreds of thousands of people that qualify and are eligible. So I understand the frustration. We've been receiving 12,000 vaccines a week. The second, if you got a first dose, Austin Public Health will be reaching out to you to tell you when to come in to get your second dose. That's going to be happening separate and independent of the otherwise registration system. APH will be reaching out to you directly, setting up a Travis County call center to reach out to people, talk to people more, to better follow up with people that have called and asked for questions, that have asked for help, and to really focus on people that are over 80 years of age or are otherwise vulnerable and need help getting their appointments. The priorities for Austin Public Health: providing vaccinations each week. Right now we're getting that 12,000 number, ensuring that the registration system is working properly, and we're constantly working to make that better. They're meeting with some of the tech folks here in the city, crowdsourcing additional assistance on the text, still maintaining the testing that needs to be going on in this city to find the new cases. They're doing the epidemiology and the surveillance work in our community to see where the virus is and where it's coming from and where it's spiking, so we can keep track of the population generally. They're also handling the education and the long-term care facilities separately and independently, because those are the folks that really have suffered the greatest level of mortality. That's both patients and residents, as well as the healthcare staff. Dealing with also with enforcement efforts to try and enforce as best we can, recognizing we can't enforce our way to compliance. People just need to do it. And ensuring that staff's up to date, all the dashboards are up to date. Also working with the infusion medical treatments. If you get this virus, early in the virus. If you're in a susceptible group, ask your doctor or physician if you can get the same kind of medicine that President Trump got when he was sick, because it is available to you. Those are all the numbers that we have today on the data dump. Hope it wasn't too many numbers. We have a city council work session today. We have a city council meeting on Thursday. We'll talk about the things that are before the city council, a lot of things on homelessness and housing and our COVID relief. We'll talk about them tomorrow. Thursday, no GAM. I'll do an Instagram when the council is over, and then we'll meet again on Friday. With that, good night, y'all. Take care and be safe.